Thank you very much. It's, as we expected, a full house, and it's wonderful to welcome you here to Royal Rehab. My name is Steve Lowndes. I'm the CEO of Royal Rehab, and very excited and very proud to be hosting our third collaborative effort with Nick Rushworth of Brain Injury Australia. And we have previously had David Bowen from the NDIA speaking with us. We had a very informative forum on concussion in sport, and today, very exciting topic on positive behavioural support, and a wonderful panel of speakers. Royal Rehab, as many of you will know, has a very vested and keen interest in positive behaviour support, both in our brain injury rehab service and in our disability support and accommodation service. And I for one, look forward to hearing today's speakers. Particularly welcome Dr. Tim Feeney, travelling from the States, where we have a very distinguished panel. And please join me in welcoming them. And I look forward to meeting you throughout the day.
Thanks, Stephen. This workshop is being held on traditional lands of the Gadigal people of the Eora Nation. I wish to acknowledge them as the traditional owners. I also wish to like to pay my respects to their elders, both past and present. I'd also like to acknowledge the support for today's workshop from both the Institute for Safety, Compensation and Recovery Research and the Lifetime Care and Support Authority in New South Wales, and from its hosts, Royal Rehab. And I particularly wanted to thank Royal Rehab's Community Relations Manager, Jim Towers, for the amount of work that he has put into making today possible. As you heard Stephen say, this is the third in what I hope will be a lengthy series of knowledge transfer and exchange events put on jointly with Brain Injury Australia and Royal Rehab. The first, as Stephen indicated, was a forum on the National Disability Insurance Scheme, held at the end of April, featuring the CEO of the agency responsible for implementation of the scheme, David Bowen. The second was a concussion in sport forum held in June, featuring the Canadian co-founders of a concussion education platform called StopConcussion.com. That will be followed up by a workshop dedicated to sports concussion in children and adolescents, to be held at Sydney Olympic Park here in Sydney on the 13th of November. From the turnout today, it would appear that challenging behaviours of concern remain true to name, concerning, a challenge for clinicians and allied health professionals, among others. I would certainly welcome from all of you any of your suggestions of topics for future events like this. So please, in the course of the day, come and speak to me about it. Or if you have any suggestions outside of today, please don't hesitate to contact me by phone or email. Before we begin, a few pieces of housekeeping. First, the toilets are directly behind you here. There is a toilet with disability access out the door to my left. Could I ask you all to turn your mobile phones to silent? For those of you who need to be reachable for whatever reason, if I could ask you to try and leave the hall to take or make a call. As with previous events like this, the workshop is being videotaped, both as a record of what's to be learnt today, but also for those unable to attend, particularly consumers, carers and family members. With this morning's speakers, Alex, Jenny and David, all of them have to leave, unfortunately, around lunchtime. But they will be available for questions over morning tea. I've asked each of them to allow a little time at the end of their presentations for questions. The questions that simply cannot wait until morning tea. I'd like you to welcome Professor Alex Colley, the CEO of the Institute for Safety, Compensation and Recovery Research. Alex.
It's still with the support of the TAC and our other partners, including in this project, Brain Injury Australia. I guess I'm sort of the warm-up pack. I'm going to tell you about the particular project we're here to speak about today, but I'm going to give an overview of what we've been doing for the last 5 years in Victoria in brain injury research generally, leading into this particular project, a series of projects we're going to spend the rest of the day talking about. TISCA, some of you may know, is a partnership between the Transport Accident Commission, Monash University and WorkSafe Victoria. And we're based at Monash University. We have a research network that spans a number of universities across Victoria and across Australia actually. We have links, direct links into the TAC and WorkSafe Victoria and a group of people in our headquarters in Tutoragi, the Opera Hospital in Melbourne, whose job it is to try to bring the research together with policy and practice insights and to make real changes in the landscape that we operate in transport and work-related activities in Victoria. So we have a very applied research program. Our mission is to work collaboratively with our partners and with others in the sector to develop, execute and translate the highest quality research that makes a difference to the clients of TAC and those at WorkSafe Victoria. TAC, in some respects, is quite similar to the Lifetime Care and Support Authority here in New South Wales. It has part of its operations responsibility for the management and support of compensation claims for people with very severe injuries resulting from transport accidents. Of course, many of those people are brain injured. And over the decade or more that I've been involved with the TAC and in this area of research in Australia, I think it's fair to say that TAC has been the largest supporter of wide brain injury research in the country. They've invested in total over $100 million in brain and spinal cord injury research in the last 15 years, since 2000. And there are many reasons for that investment, and they make good sense. Obviously, motor vehicle accidents are the most common mechanism of cause moderate severe brain and spinal cord injury. And the model that we have in Victoria, and you have up here now through Lifetime Care and Support Authority, is to provide lifetime care and support for those people who are injured on a no-fault basis. And so there's an economic imperative here. In what's known as the independent claims branch, which is the part of the TAC that looks after the very seriously injured people, the costs of the TAC and that branch per case of brain injury are about $2.3 million lifetime care cost and about $5.8 million per case of orthopedic. They make up less than 3% of all of the claims in the TAC system, yet account for 2/3 of the organisation's outstanding liabilities. So a small group of people that are very expensive to the state. And 80% of the liabilities in that small group of people are made up of lifetime care and support costs, attendant care and those sorts of things. And at the beginning of this project, we're going to be talking, a program of work we're going to be talking about today, we did some estimations to try to figure out how much of the annual expenditure in that independent branch with attributable challenging behaviours. It's about 10% of the annual cost, which from memory is something like $70 million per annum cost. So it's a big issue. There's a big economic case for using research to make a difference. And of course, it's a win-win if you can improve the health, social functions and well-being of people with PBI and their carers. That's a wonderful objective, but we will also reduce the cost of the insurance scheme. So this is why TAC invests in research. And what I'd like to do just in the next few minutes is take you through a few examples of the type of applied work that we've been doing in Melbourne in an attempt to achieve both of these outcomes, the health and wellbeing and independence outcomes and also the economic outcomes. Before I do that, I'd just like to remind you that there are many examples. This is just one of them where strategic investment in this sector can make a big difference. So in Victoria, 15 years ago, we radically transformed our acute trauma care system. A lot of that transformation was funded by the TAC as well as the Department of Health. Essentially what we did in Victoria was we denoted two of the hospitals as major trauma centres, the Alfred and the Royal Melbourne, and we developed a way of streamlining acutely critically injured people to those trauma centres. More easier to do that in a smaller state like Victoria. And we also set up at the same time a thing called the State Trauma Registry to monitor the outcomes that were being achieved by all the reorganisation of the care delivery system. And it was a major investment by the state, including by the TAC. And it has made a big difference in how likely you are to die if you're in hospital following a road transport-related major trauma. So This is a study published in the Annals of Surgery early this year by Linda Gabbe, who runs the Trauma Registry Monitoring Group, showing that in 2010-11 your odds of dying in hospital were nearly half of that what they were when we changed the trauma system back at the start of this century. So investing in this stuff can make a big difference, and it can save lives and it can save money. So TAC's history over that 15-year period, they've invested in research through a variety of mechanisms, initially through what I would call occasional project funding prior to 1999, and then they established in 1999 with the establishment of that new approach to trauma care in Victoria, an organisation called the Victoria Trauma Foundation, which focused mainly on pre-hospital and acute care of people with major injury, and really set up some of the fantastic things that we're now benefiting from in Victoria. Then in 2005, the state government with TAC support funded a thing called the Victorian Neurotrauma Initiative, which I had the pleasure of leading for a few years, which focused on biomedical acute care and started to do a bit of rehabilitation research as well. And then in the last 5 years, we at ISCA have been leading the neurotrauma research with the TAC, and we've really taken a strong focus on the rehabilitation of lifetime care in this country. When we started working with TAC on this back in 2011, we established a neurotrauma research strategy, which was the product of about 12 months of consultation with a whole variety of people across the sector in Victoria and Australia. And the strategy at the bottom here really defined 4 areas of work. 2 of them which would be the focus of most of our investment over the following 4 or 5 year period. They were what we call models of lifetime care and improving rehabilitation of disability management. And this set of projects around challenging behaviours or behaviours of concern fits in this priority in our neurotrauma strategy. That's where the funding from is coming. I'll just give you a couple of examples of some of the other work that we've done, just so you know what we've been up to over the last 5 years in Victoria. One of the projects that we have been working on in close collaboration with the TAC has been evaluating the impact and doing some design work on a thing called RIPPLE, which stands for Residential Independent Proprietary Limited, which is a subsidiary established by the TAC with a $30 million investment to design and deliver new accommodation for clients with high complex care needs. There are, I think, 4, maybe the 5th one is being built at these facilities around Melbourne, dotted around the suburbs in Melbourne. And we've had a number of projects linked to this development, including 3 of the post-occupancy evaluations which are underway, some of which have been delivered. And the result from those findings so far have led to changes in the design of the accommodation and also the support models delivered within these TAC funded developments. We will help in the future to deliver better quality of life living in these apartments with brain inspiring. So a very applied research program. We've been involved in a new ABR rehab centre in Caulfield Hospital. I think there's some people from Caulfield Hospital here today. So this is a pretty new 42 beds or inpatient community rehab service for people required by injury statewide across Victoria, opened just over a year ago. In the 18-month period leading up to it opening, we at the TAC funded a project to establish an evidence-based model of care that will be delivered in this new rehab service. And we've also supported a follow-up project which is evaluating the care model in practice with researchers embedded in the new unit who will do important feedback. Feeding back to the team trying to make sure that the care that's being provided is meeting the best practice guidelines developed prior to the sector being established. And we're just imminently sort of about to receive the results from the early stages of this experiment, if you like, and so far it's good. So again, a very applied, rehabilitation focused part of our research program. In total, so that's just a couple of examples, there are many others. In total, under the neurotrauma research strategy in Victoria, we've invested $20 million and have initiated 45 projects. 29 of them have a focus on brain injury, of which 11 of those are complete. So just last week, if you're interested, we released a summary of all of those projects via our newsletter and on our website, which is discipline.com.au. So if you're interested in hearing more about them, or knowing them, you can follow me up or you can have a look at our website. Many of the projects have research activity continuing through to 2018, and so there's a large volume of research that's just getting underway that will take place over the next 2 or 3 years, which will findings of which will be implemented beyond. And as we were coming to a conclusion in investing this funding, we had the impact of a number of the projects evaluated, and those that were far enough advanced to enable evaluation, the results were just quite positive. This was conducted by an independent reviewer. We used a sort of a well-validated method to estimate both the quality of life impact arising from some of these projects and the financial impact arising from some of these projects. This slide is a little bit hard to interpret, but essentially it says of the 9 projects that the independent reviewer examined, many of them will have a major, or estimated to have a major impact on the quality of life of people for age 943, and the reach of those projects will be mainly on national or global scale. Some of them, as we develop them, are expanding in reach and expanding in their impact on quality of life. There's a summary of this report also available on our website for those interested in looking at it. And a subset of those were able to estimate some of the financial impacts for the TFC, and this also suggests that in the future, over the next 5 to 10 years, there will be a fairly significant return on investment for the TAC from a set of these projects. Not from all of them, not every project is designed to deliver a financial benefit. Some of them, there will be flow-on financial impacts as well. So, lastly from me, so that's a bit about what we've been doing in Victoria with our neurotrauma research program in the last 5 years, a whole raft of projects with some early indications that they're having a positive impacts. I'll just take questions. I'm almost finished, so I'll take questions in at the end. This research program that we're going to talk about today really started back in 2011. It was identified specifically as a priority in our neurotrauma strategy, as one of the things that we wanted to tackle. In 2012, in December 2012, we hosted through the MTRI, National Trauma Research Institute, stakeholder dialogue, which really which engaged Tim Feeney. I think it was the first time I met Tim. He came to Melbourne to participate in this, as did 20 other people from around the sector in Victoria and Australia. And the outcome of that dialogue was a bit of a roadmap for how to move forward with research projects addressing this area of need. And for the last 2.5 years, Jenny Bonsford and her team have been working with the TAC on a project to identify the factors in Victoria amongst TAC and other clients that contribute to challenging behaviours, and Jenny's going to describe that to you today. And then we're moving into this phase now where we're starting information trials, positive behaviour support. So it's been a process over a number of years to get to this point in time, and it's one of the things that we've been focused on throughout the broad neurotrauma strategy. I'm not going to tell you much about it. We'll hear about that from others today. So that's it from me. I'm happy to take a couple of questions if there are burning questions. I can't wait until morning time.
How many of the research, is any of the research paediatric focused?
There are not many paediatric program research projects in this particular piece of work. There's 1 or 2. There's quite a lot of paediatric research being supported by TAC through the Victorian Neurotrauma Initiative, which is the preceding research fund. In the middle of those 3 things that I mentioned, there's quite a lot of paediatric research in there, some of which is just coming to, or has just recently completed as well.
Other burning questions that can't wait till morning 2? If not, can you please thank Alex for that?
Okay, so I'm Jenny Ponsford. I'm a very lucky recipient of some of these grants from ISCO, and I have to say, were it not for ISCO and Victorian Neurotrauma Initiative, my research, the research productivity of our research would be significantly lower. So this project that we're engaged with is being conducted in collaboration with Professor Malcolm Hopwood, Justin Canardi, Kate Gould, Yvette Krivenos, Amelia Hicks, and now, fortunately, Dr. Tim Feeney. Behaviours of concern, there are many definitions of them, but they generally involve the potential for some harm to the injured individual or others, or perhaps more commonly, problems with access to the community and problems with relationships. Now we know that these problems, they're not always incredibly severe. They can be from mild irritability through to really extreme problems, but they are somewhere on the spectrum extremely common following moderate to severe traumatic brain injury, and they tend to persist over many years. We know from our outcome studies that they have a significant impact on the person's social interaction, that they can result in breakdown of relationships, problems in people staying in accommodation, and our studies of families have identified that they represent the greatest source of stress to family members and others who are caring for them. They also represent a significant source of financial burden. So we've been following up a cohort of patients, again with the support of ISCO, over many years now in a longitudinal head injury outcome study. And we've got about over 2,000 patients in this study. And we asked them at 1, 2, 3, 5 and 10 years following injury, what is the nature of difficulties they're experiencing? So amongst that, we asked them about their behavioural changes. And as you can see, 60% of this cohort, who are predominantly moderate to extremely severe injuries, say that irritability is a problem for them. And interestingly, even though this is based on self-report, we still get 25 to 40% telling us that they need more prompting to get things done, that they're more self-centred, that they're more impulsive, and that they have inappropriate social behaviour. And as you can see, these reports are not decreasing over time. If anything, they are increasing, probably reflecting the growth in self-awareness by those who are injured. But despite the prominence of these problems, there have been relatively few studies that have looked at behaviour problems over many years following injury. Most of the studies focus on the acute stages of recovery. And most of the studies that have been conducted have been conducted from the perspectives of family members or from clinicians working with these individuals. So very few studies have looked at the perspective of the brain injured individual, which is of course important. And it's also not clear what services people with behaviours of concern are receiving in the community and how they might feel they were benefiting from these. So a couple of years ago when we engaged with ISCO, there was, as Alex described, there was a big series of panel discussions in which we identified that behaviours of concern were a significant problem, and in particular also were a significant financial burden to the TAC, who fund attending care worker support and treatment for these people. So you can understand that they might want to do something about these behaviours in order to try and save themselves some money. So this was kind of the impetus for coming to us as a group of people, which was Malcolm Hopwood and Justin Canardi and myself, and saying, we want you to develop an intervention for these people. So we felt, though, that it was important first to identify whether these people that were costing the TAC a lot of money actually had behaviours of concern, if so, what type of behaviours of concern they had, and what sort of services they were already receiving in a fairly richly funded environment. So we then set about this first phase of the study, which was to determine the nature of behaviours of concern in these TAC clients and look at the nature of services they were receiving. So we took both a quantitative and a qualitative approach to this study, which focused on the brain injured individuals, close others and clinicians. So we conducted a series of telephone interviews, collecting demographic information from them about the treatments they received, and their perspectives on their behaviour changes, their satisfaction with treatment. We collected objective measures, and we also had access to their files to get information about the actual treatments they received and their injury information. So the measure of behavioural change that we used was the Overt Behaviour Scale, developed by Glenn Kelly and colleagues, which documents behaviours exhibited in the previous 3 months in the domains of verbal and physical aggression, inappropriate social behaviour, perseverative or repetitive behaviours, wandering or absconding, inappropriate social behaviour, and lack of initiation. So the clients were a bias sample, and I acknowledge this in describing these outcomes. They were clients of the TAC in Victoria, which, as Alex said, is a uniform accident compensation system providing lifetime support to these people. We focused on people with moderate to severe TBI who were 16 years or over, and the TAC, using a number of markers, identified individuals that they felt were exhibiting behaviours of concern either currently or in the past. So they selected a sample of 223 individuals, and of those, unfortunately only 106